Helping children thrive takes expert care and compassion. Dr. Brent Reifsteck from Carle Foundation Hospital's Children's Institute joins us to discuss key topics in pediatric health and development. That's what's next on Being Well.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle is always at the forefront to help you thrive.
Thank you for joining us for another episode of WEIU TV's Being Well. I'm your host, Lacey Spence, and today we are going to be talking about offering excellent care to some of our youngest patients. And to do that, we are welcoming a new guest to the show. Coming to us from Carle Foundation Hospital, we've got Dr. Brent Reifsteck. Welcome to Being Well.
Thanks for having me. I really appreciate it.
Of course, we're excited when we get to have new guests because that means our viewers get to meet new people. So can you please give us a little bit of background, where you're from, and who is Dr. Brent Reifsteck?
Sure. So I was born and raised in Central Illinois, Southern Champaign County to be exact. Didn't go very far from home, so I did my undergrad at U of I did medical school at the University of Illinois, went really far away to pediatric residency in Peoria.
Whew.
I know. And then once I graduated from residency and officially became a pediatrician, I started working at Carle. But here locally, I worked at Carle in Mattoon as a primary care pediatrician, and so also worked over at Sarah Bush as one of the pediatric providers, just working on women's and children's.
Sure.
So that was great. I got to meet some really great people, lifelong friendships that I still have.
Yeah.
And then in 2011, I moved up to the hospital full-time to work as a hospital pediatrician and help start our child maltreatment program. And also, came full circle up to the Urbana campus. Then was promoted to Associate Medical Director of Inpatient Pediatrics in 2018, and then Medical Director of Children's Services in 2020.
And so it's very exciting to have that role, to kind of be able to spearhead initiatives and see things kind of come together. And today we're going to be talking about the Children's Institute, which you all were telling me before we got recording that it's not like a physical building, but it is very important to patient care. So can you explain what that is?
For sure. So this is a concept that's followed in many children's hospitals across the nation, where it's not a freestanding space or building. It's a collection of services that rises to a certain level that provides a level of care and expertise that's different than other places and allows us to connect with each other, provider to provider, in a way that enhances the care that we deliver. So, it's not the same as a, children's hospital in St. Louis or a Lurie Children's Hospital in Chicago, but having enough services, enough specialties, and the level of expertise to all connect in a very meaningful way to bring value to our patients and families is kind of the idea. Also, one thing we learned during pandemic is regionally, we really are a healthcare safety net.
Okay.
And making sure that we can take that role very seriously, no matter what the age of the patient is, became extremely important to us as a system.
And overall, you all have a pretty high level of critical care as well. Are you able to talk about what that designation is?
Yeah, I'd love to, because it was a lot of hard work to get there. So there are 3 levels in the state of Illinois where they designate a hospital as, in relation to how they can care for children. So the lowest level basically is there to just stabilize and get them somewhere else. An EDAP, or Emergency Department Approved for Pediatrics, is what many of the hospitals are, because they can do most things for children when they land at their facility. The highest level is a Pediatric Critical Care Center designation, and Carle Foundation Hospital in Urbana last March was awarded a Critical Care Center designation for pediatrics. And the important thing to know there is there's only 3 of those outside of Chicago in the state of Illinois.
Wow.
And 11 total. So we were excited to have that. And basically what that means is we can handle almost all cases of pediatric illness, regardless of the severity, without needing to send those families elsewhere. So the goal, as always, is to provide really great care and keep families close to home.
And so if I'm unfamiliar with the services that you all offer, are you able to maybe list off a few conditions that maybe aren't especially common, but that might perk somebody's interest of like, oh, I didn't know I could do that there?
Sure. We have pediatric general surgery, which is different than most places, to be able to provide surgical care to our littlest patients with both pediatric surgeons and pediatric anesthesiologists.
Okay.
We also have pediatric cardiology and endocrinology, so type 1 diabetes and things like that, metabolic problems. We have, and the cardiologists we have are able to treat most cardiac issues outside of cardiac surgery.
Okay.
In addition, we have a visiting rheumatologist, which is pretty uncommon. So pediatric rheumatology, things like autoimmune disorders and juvenile idiopathic arthritis would be something that we can take care of here that we really weren't equipped to do before. We have a geneticist, we have a pulmonologist, we actually have our own PFT box. So PFT stands for pulmonary function test.
Thank you.
Kind of hard to do that in a kid, because in adults you can, use a mask, you can do a number of different things, but in kids, they're just fidgety, right?
Yeah.
So in order to check their pulmonary function, we actually put them in a clear box that then measures how their lungs are functioning. And that was a generous gift from a donor who is a former pediatrician at Carle, Dr. Robbins.
Mm-hmm. But it's nice to be able to, again, they're not your typical patient.
Right.
Trying to get them to sit still, and especially if they're not feeling good or they're, worried about what's going to happen, if they're going to get poked and prodded, anything you can do to help put kiddos at ease is going to help.
Yeah, I love that you said it that way, because it's, to most lay people, children are just small adults, right? But in the practice of medicine, children are not just small adults. Mm-hmm. We have our own specialty because they are so unique physiologically, and their physiology changes so rapidly as they grow. And having the right people in the right place to care for each of those children, specifically based on where they're at in that process, is really important. So just taking what they do for adults and making it smaller and applying it to kids, it's just not the right way to do it. Mm-hmm. And that's an important philosophical difference between adult medicine and pediatrics.
So when you talk about metabolic disorders, are you able to help detect those through like blood draws? Do you have processing there, like a lab that can, kind of run through those numbers and help relay to doctors what's going on in their child?
Yeah, we have a great partnership with our lab, and if we don't have what we need, we know where to send it.
Okay.
And having a partnership between our geneticists and our endocrinologists allows us to kind of tailor the care to those kids. Luckily, in the state of Illinois, the normal newborn screen that's done on every birth in Illinois, it casts a really wide net. So we know about a lot of those things immediately after birth, but not everything. And for some kids, they just need a little special attention. And so having the array of specialties that we have now allows us to tailor that care and really do a good investigation when there's a medical mystery in front of us.
Oh, that's very exciting. And so as we are talking about different age ranges, do you treat, what is like the oldest child that you would treat, and then I assume down to infants and newborns?
Yeah, so at birth, I mean, those are our first patients.
Yes, okay.
And it depends on who you ask, how, what's the upper limit of age? Because according to the American Academy of Pediatrics, we need to be able to take care of patients up to age 25. But in general, we cut things off at 18, just because that's a nice clean number and makes it easy to communicate with our adult colleagues when it's time to transition. But in general, it's those early childhood years that are most critical at diagnosing and treating disease.
And so what would you say is maybe the most common thing that is coming through you all's doors that is really proving that the Children's Institute is so worth it?
Well, it depends on the time of year, because in the winter months we see a load of respiratory illnesses, so things like RSV, rhinoenterovirus, bronchiolitis is the general term for the illness that causes. But in the summer, we see, for some reason, lots of seizures or traumas. So our trauma team takes care of those in consultation with us. And so it just keeps us really busy. But having a pediatric endocrinology team at Carle Foundation Hospital now allows us to keep the children who have, for example, new onset type 1 diabetes, which can be a really life-changing diagnosis for a family. In the past, we would get them, kind of ready. We'd start the process and then send them away to get their endocrinology care. But that's not optimal for a lot of families. Even with some endocrinologists being 75 miles away or 90 miles away, for some families, that's just not good enough. And it shouldn't be, because if we have the capability of providing that care locally, we should really do our best to do that. And so it really makes me proud to be able to provide that full wraparound care with diabetic educators and nutritionists and our endocrinologists to help those kids from the beginning all through their childhood until they transition to adulthood.
Plus, just thinking of logistics, taking off work, time away from daycare or school, anything that you can kind of kill two birds with one stone while you're there is going to help out their family as they're working through this. We've talked a lot about treating children, caring for them as well. But I would like to also mention that you are helpful in women who are preparing for birth. Can you kind of talk about what those options look like?
Sure. So, we have a great team of women's health providers, both on the ambulatory side and on the inpatient side, as well as a OB-GYN residency program. So we have folks who are new doctors but are learning to be women's health providers to help with their team. But one of the most critical parts of that team are our maternal fetal medicine providers, who take those moms who might need a little extra attention due to a condition they have or a prenatal condition that's identified in their baby, and really wrap our arms around those families and make sure that, is it safe for you to deliver here? Or do we need to talk about making sure that you are delivering at a facility that can address other needs that you have, but then plan on you coming right back here once those needs are addressed? And trying to navigate those things can be really complicated and scary for families.
Sure.
So it's really important to have folks they trust here locally, and the only way to help them or to help build that trust is to provide the services that make them feel comfortable. And that's always going to be our goal.
And in part of that comfort, special inpatient rooms for children. You were kind of talking earlier about how you don't just make stuff smaller for the kids, but having sort of welcoming and inviting environments like that, what does that kind of look like?
Oh, I love that you asked that. It's one of my favorite parts. So, having a pediatric inpatient unit that is welcoming is important, but marrying that welcoming part with the right services that they need and making sure that all of the facilities are prepared for the sickest kids, that's kind of a hard thing to do. But I feel like our teams have done a good job of putting that together. We have child life specialists, as well as, lactation consultants. We have mental health specialists and, teams of multidisciplinary providers who can kind of wrap their arms around these families and make sure they have everything they need. And one of my favorite parts of our unit, which opened in 2020 with some new rooms, is we call it a progressive care unit, which means we have peds ICU rooms right next to peds advanced care, or that kind of intermediate care rooms right next to general pediatric inpatient rooms, which means that a family could potentially be admitted into one room and stay there the whole time without having to move from unit to unit until they go home. And that is an intangible thing that most people don't think about, but it's annoying if your kid's sick to get into the hospital, get admitted to a room, and then have to move a day and a half later, and then have to move a day and a half after that,
and
then
you brought
go
their
home.
favorite toys,
Right.
The comfort blanket,
Right.
And all of that has to go. You forget that behind, and it's a meltdown. It's the end of the world.
Yes. Yes.
So that's helping ground them. So that sounds like a really interesting setup. What kind of feedback are you hearing from parents and families? I'm sure it has to be, great reviews or excitement that you all have decided to look at the care process a little differently and try to make it more fluid for them.
Yeah, we've received good feedback, especially, from our families that have children with conditions where they end up visiting us frequently. That feedback's really valuable, so we listen to it very closely.
Yeah.
But just being able to provide them a different experience than in the past, many of them are appreciative. And that is one thing that we take very seriously whenever we get that feedback from parents, in order to decide, do we need to adapt? Do we need to be, do things a little bit differently to enhance their experience? We're constantly pouring through that feedback. So, it's been very positive since we opened the progressive unit, but we're always looking for ways to make it even better.
And that's reassuring, because I think it's easy to get maybe stuck in a rut, or we've always done it this way, so we're going to continue to do it this way.
Oh,
and it sounds like that's the exact opposite.
As a leader, as a physician leader in the organization, that's one of my least favorite phrases.
Yeah.
That's how we've always done it. I would prefer to tear it all down and build it up new if it means we're going to do it better. And, being able to provide that care in a way that makes sense and that is always ready to adapt, I think is really key.
And so I know that you've touched on a few of the pediatric conditions that are covered. I am seeing in my notes here 20 pediatric specialties under one roof. Are you able to elaborate on a few more of those, just so people at home, again, kind of hear, well, hey, this is what my kid is suffering with. Maybe I should seek care here.
Sure. So pediatric neurology, so neurologic conditions. Urology, we have a urologist that visits us 1 week out of the month. So conditions involving the urinary tract. And under one roof is really all of our specialists are in one spot in Urbana. They're actually moving to a different floor because we're landlocked and we're running out of room for our current providers, which is a good problem to have. And the only one that I haven't mentioned yet that I think is important is behavioral and developmental pediatrics.
Okay.
And we have a good team there to provide care, for those kids that have challenges when it comes to their development or challenges when it comes to their behavior. Those folks are not in Urbana, they're at the clinic in Champaign on Curtis, but they also have their own sensory room there for children with sensory needs. We also have a sensory room in our emergency department in Urbana to cater to those folks who might have sensory triggers, and a whole sensory pathway to, communicate to staff that, oh, this is a patient that might need some extra help. And those sensory rooms are kind of fun to be in, even if you aren't a sensory patient. So I always try to, slide through there when I'm giving tours to candidates and things like that, because I think it's really cool.
So as we're in our last several minutes here, is there anything that I haven't asked you about yet that you feel is important for the people at home to know?
For sure. I feel like we live in a different world when it comes to healthcare than, say, 15 years ago.
Okay.
And, even though most of our pediatric services are centered in Champaign-Urbana, Carle as a system has pediatricians in lots of places throughout central Illinois to provide care to those kids. They might not technically be part of the Children's Institute at Carle Foundation Hospital, but we're connected to all of them. In fact, we're very closely connected even to pediatricians outside of our Carle network that work for a different clinic system or that are independent. And I call them our extended family.
Yeah.
So, using virtual health and electronic medical record capabilities, and as simple as our phones, we're able to stay connected to pediatric providers regardless of where they're at, and really try our best to bring the care close to families and make sure that the communication is good, so that those pediatricians feel supported. So connecting across all of central Illinois and really being that go-to for pediatric care is really important to us.
Well, and I feel like viewers are probably going to hear me say that a lot this season, but we serve a lot of rural communities, and we're really proud of that, and we always get excited when on this show we can talk about our different medical centers and providers that are reaching into these rural spaces. A lot of times the technology and things, unfortunately, are a little bit behind when trying to reach our smaller hometowns. And so it's exciting to hear that extended family, that camaraderie, all for the good of the kids. So as we're wrapping up here, is there anything in your time working in this role, kind of seeing things grow and develop, what is your takeaway? How excited does it make you to be able to provide care like this?
One thing that really excites me is, 15 years ago, somebody brought up, being a bigger center for pediatrics and doing things like a pediatric residency program or a freestanding children's hospital, that I was like, that's big. Like, that's not, we don't have the volume for that. We don't have the acuity for that. Fast forward to now, we have worked really hard and really brought a larger team together where it doesn't feel so far-fetched anymore. And that's a big responsibility and a privilege to be able to help build a pediatric program that can serve the largest number of people in the place where I'm from, and to give back to my hometown, my home area, in a very tangible way. That's exciting, and I am never going to stop pushing to make it grow and get bigger and better and bring more value.
In under a minute, if you had a wish to make this bigger and better, what would top your wish list?
Ooh, hands down, a building brick and mortar
Yeah.
that could say, this is our women's and children's tower.
Yeah.
It's like a tease off in the distance that we keep toying with.
Yeah.
I don't think we have the geography for it on the main campus, but it's always something in the back of my mind as something high on the wish list.
Never hurts to dream. Dr.
Right?
Brent Reifsteck, thank you so much for being here today on Being Well. I sure appreciate it.
Thanks for having me. I really had a good time.
I'm glad to hear that, and we hope our viewers enjoyed this episode of Being Well, and I hope to see you next time.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.